In a historic move that has sent shockwaves through communities across the United States, the House of Representatives has just approved three major immigration reform bills that could fundamentally change the landscape of immigration policy in America, with particular implications for the state of Texas. If you're a senior citizen, a taxpayer, or someone who cares about the future of this country, you need to understand what just happened and how it could affect you, your family, and your benefits in the coming months and years. Let me start by saying this. What we witnessed in the House chamber wasn't just another routine legislative session. This was a pivotal moment that politicians, activists, and everyday Americans have been debating for decades. The passage of these three bills represents the most significant shift in immigration policy we've seen in years, and the fact that it happened so quickly has caught many people completely off guard. Some are calling it a victory for law and order. Others are calling it a disaster for human rights. But regardless of where you stand politically, one thing is absolutely certain. These changes are coming, and they're coming fast. So what exactly are these three bills, and why should you care? Let me break this down for you in plain English, because the mainstream media isn't giving you the full story, and the politicians certainly aren't being transparent about what this really means for regular Americans like you and me. The first bill that just passed focuses on border security and enforcement. This legislation dramatically increases funding for Border Patrol agents, expands the physical barriers along the southern border, and implements new technology systems designed to track and monitor individuals crossing into the United States. For Texas specifically, this means a massive influx of federal resources being directed toward the nearly 1,300 miles of border that the state shares with Mexico. We're talking about billions of dollars in funding that will go toward construction, personnel, surveillance equipment, and detention facilities. Now, you might be thinking, well, that sounds like a good thing if it keeps our borders secure, and maybe you're right. But here's what they're not telling you. This increased enforcement comes with a price tag, and that money has to come from somewhere. Some analysts are already warning that this could lead to budget cuts in other areas, potentially affecting programs that seniors depend on. We're talking about Medicare, Social Security, veteran benefits, and other social services that could see reduced funding as Congress shifts priorities to pay for these border security measures. This is something you need to be aware of because it could hit your wallet directly. The second bill addresses what's being called interior enforcement. This is where things get really interesting and potentially concerning for many Americans. This legislation expands the authority of Immigration and Customs Enforcement, commonly known as ICE, to conduct operations throughout the entire country, not just near the borders. It increases penalties for sanctuary cities, requires local law enforcement to cooperate with federal immigration authorities, and creates new criminal penalties for individuals and organizations that provide certain types of assistance to undocumented immigrants. For seniors living in Texas and other states with large immigrant populations, this could mean significant changes to your communities. We could see increased ICE presence in neighborhoods, more checkpoints, and a general atmosphere of heightened enforcement that affects everyone, not just undocumented individuals. Some legal experts are warning that this expanded authority could lead to situations where American citizens, including seniors, could be questioned or detained if they happen to be in the wrong place at the wrong time or if they don't have proper identification readily available. Think about that for a moment. How many times have you run to the grocery store without your wallet? How often do you carry your birth certificate or passport with you? Under these new enforcement protocols, there are concerns that innocent people could get caught up in sweeps and operations, leading to confusion, delays, and potential violations of civil rights. This isn't fear-mongering. This is a legitimate concern that civil liberties organizations are already raising alarm bells about. The third bill tackles what lawmakers are calling asylum and refugee reform. This legislation fundamentally changes how the United States processes individuals seeking asylum at the border. It raises the standard of proof required for asylum claims, limits the types of persecution that qualify for asylum protection, and creates expedited removal procedures that could result in people being deported within days, rather than having their cases heard in immigration court. Supporters of this bill argue that it closes loopholes that have been abused by economic migrants who don't qualify for asylum but use the system to gain entry to the United States. Critics counter that it violates international humanitarian law and puts vulnerable people, including women and children fleeing violence, at serious risk. Regardless of your personal views on this debate, the passage of this bill means we're going to see major changes in how asylum seekers are treated at the border, particularly in Texas border communities that have been on the front lines of this issue. Now let's talk specifically about Texas, because what's happening in the Lone Star State right now is absolutely unprecedented. Texas has been at the center of the immigration debate for years, but recent developments have pushed tensions to a breaking point. Governor Greg Abbott has implemented what he's calling Operation Lone Star, a state-level border security initiative that has already deployed thousands of Texas National Guard troops and state troopers to the border region. With these three new federal bills now passed by the House, Texas officials are celebrating what they see as federal validation of their approach. But here's what you need to understand. The cooperation between state and federal authorities is about to intensify in ways we haven't seen before. This means more resources, more enforcement actions, and more controversy surrounding how immigration policy is implemented on the ground. For seniors living in Texas border communities, this could mean dramatic changes to daily life. We're already hearing reports of increased traffic delays at checkpoints, Border Patrol presence in areas far from the actual border, and economic disruption in communities that depend on cross-border commerce and tourism. Small business owners in these areas are worried about how these changes will affect their livelihoods. Healthcare facilities are concerned about their ability to provide care to everyone in the community. Schools are grappling with how to handle situations where students or their families might be affected by enforcement actions. But it's not just border communities that will feel the impact. Cities like Houston, Dallas, San Antonio, and Austin could see significant changes as well. These urban areas have been designated as sanctuary cities or have policies that limit cooperation with federal immigration enforcement. Under the new legislation, these cities could face serious financial penalties, loss of federal funding, and potential legal action if they don't comply with the new requirements. For seniors living in these cities, this could translate to reduced municipal services, budget shortfalls that affect everything from public transportation to senior centers, and increased local taxes as cities struggle to make up for lost federal dollars. This is a real and immediate concern that could affect your quality of life in very tangible ways. Let's also talk about the healthcare implications, because this is something that directly affects seniors and is getting almost no attention in the mainstream coverage of these bills. Undocumented immigrants currently make up a significant portion of the healthcare workforce in the United States, working as home health aides, nursing assistants, and in other essential care positions. With increased enforcement and the threat of deportation, we could see a shortage of healthcare workers just when the senior population is growing and needs more care than ever. Think about the person who helps you with daily activities, the aide who comes to your home, the workers at your assisted living facility. There's a very real possibility that some of these individuals could be affected by these new enforcement measures, leading to disruptions in care and difficulty finding qualified workers to fill these essential positions. This isn't a theoretical problem. Healthcare industry experts are already warning about this potential crisis. Now, I know what some of you might be thinking. These are just bills passed by the House. They still need to go through the Senate and be signed by the President before they become law. That's absolutely true, and there's no guarantee that these bills will pass in their current form or even pass at all. But here's why you should be paying attention right now, even before they become law. The fact that these bills passed the House with significant support shows a clear shift in political will when it comes to immigration enforcement. State governments like Texas aren't waiting for final federal legislation. They're already implementing their own measures and pushing the boundaries of what they can do at the state level. The passage of these House bills gives political cover and momentum to even more aggressive state-level actions. We're already seeing Texas and other states introducing their own legislation that mirrors or even goes beyond what's in these federal bills. Some states are creating their own border enforcement units, passing laws that criminalize certain activities related to undocumented immigration, and implementing systems to verify immigration status for access to state benefits and services. For seniors, this last point is particularly important. There's growing concern that verification systems designed to prevent undocumented immigrants from accessing benefits could create bureaucratic nightmares for legal citizens as well. Imagine having to prove your citizenship status repeatedly just to access Medicare, Social Security, or other benefits you've paid into your entire working life. Imagine the frustration of dealing with new systems, new paperwork, and new requirements just to get what you're legally entitled to receive. This isn't hypothetical. We've seen similar situations occur when states have implemented strict verification systems in the past. Legal citizens, particularly elderly Americans who may not have easy access to birth certificates or other documents, can get caught up in bureaucratic tangles that delay or deny their benefits through no fault of their own. With these new bills pushing for stricter verification and enforcement across the board, this problem could get significantly worse. Let me also address the economic implications that aren't being discussed enough. Immigration, regardless of your personal views on it, is deeply intertwined with the American economy. Undocumented workers contribute billions of dollars to Social Security and Medicare through payroll taxes. Even though many will never be eligible to receive those benefits, they work in industries ranging from agriculture to construction to hospitality, often doing jobs that American workers are unwilling or unable to fill at current wage levels. If these bills lead to mass deportations or cause undocumented workers to flee certain states, we could see serious economic disruptions. Food prices could rise as agricultural operations struggle to find workers. Construction projects could be delayed or canceled, affecting property values and development. Service industries could face labor shortages that drive up costs for consumers. For seniors on fixed incomes, rising costs for food, housing, and services could create serious financial hardship. Your Social Security check doesn't go up just because the cost of living increases dramatically. Your pension doesn't adjust for sudden inflation caused by labor shortages. These are real economic consequences that could flow from the implementation of these immigration bills, and they could hit seniors particularly hard. There's also the question of what happens to mixed status families. These are families where some members are legal citizens, including seniors, but other family members might be undocumented or have uncertain legal status. With increased enforcement, we could see situations where families are separated, with serious implications for seniors who depend on family members for care and support. Imagine being an elderly American citizen who relies on your adult child to help with daily tasks, medical appointments, and household management. Now imagine that your child's spouse, who also helps care for you, is suddenly detained and faces deportation under these new enforcement measures. This creates not just an emotional crisis, but a practical one. Who will care for you? How will you manage? These are the human stories behind the policy debates, and they're affecting real American families right now. So what should you do with this information? First, stay informed. Don't rely on just one news source. Read multiple perspectives, understand what's in these bills and what could be coming next. Second, know your rights. Whether you're a citizen or not, you have constitutional protections. Understand what those are and how to assert them if necessary. Third, get your documents in order. Make sure you have easy access to proof of citizenship, whether that's your birth certificate, passport, or naturalization papers. Don't assume that your age or appearance will be sufficient to prove your legal status if questioned. Fourth, pay attention to what's happening at the state level, particularly if you live in Texas or other border states. State legislatures are moving fast on immigration-related issues, and these state-level changes could affect you even more directly than federal legislation. Finally, make your voice heard. Contact your senators and let them know how you feel about these bills. Attend town halls, vote in every election. Your participation matters, especially as these issues move forward. The passage of these 3 immigration bills by the House represents a major turning point in American immigration policy. Whether you see this as long overdue reform or a dangerous overreach, the implications are far-reaching and will affect millions of Americans, including seniors who may think these issues don't concern them. From potential impacts on Social Security and Medicare funding, to healthcare worker shortages, to economic disruptions that drive up costs, to civil liberties concerns about enforcement overreach, these changes could touch every aspect of life in America. For Texas specifically, the combination of aggressive state-level enforcement and new federal legislation creates a unique situation that bears close watching. The Lone Star State is becoming a laboratory for immigration enforcement policies that could eventually spread nationwide. What happens in Texas over the next few months could shape the national conversation and determine how these policies are implemented across the country. This is a developing story, and things are changing rapidly. Stay tuned to this channel for updates as these bills move through the Senate and as implementation begins. Make sure you're subscribed so you don't miss critical information that could affect you and your family. Share this video with other seniors who need to understand what's happening. Knowledge is power, and in times of rapid change, staying informed is more important than ever. The immigration debate has always been contentious, but with these three bills now advancing through Congress and states like Texas taking matters into their own hands, we're entering a new phase that will define American policy for years to come. Whether that's a good thing or a bad thing depends on your perspective, but one thing is certain. Change is coming, and being prepared is the best thing you can do to protect yourself and your loved ones.